Hey everyone, on this episode of the BrokerLink podcast, we're talking with David Ireland about how to get started in Medicare sales. Whether you are brand new to selling insurance or you're just looking to expand your portfolio, today we're going to give you a step-by-step guide on how to get started. Stay tuned. Hey David, thanks so much for spending time with us today. Let's start out by learning more about you and your background.
All right, well, thanks for having me, Gillen. So I've been in the Medicare business about 11 years. Actually started off as an agent. Got my insurance license at the advice of a friend. Started selling for United Healthcare, worked my way up through management, and I've been here with the brokerage for about 2.5 years now.
Nice. So getting your license, were you doing something before Medicare, or did you start with Medicare?
Well, actually, my first career out of college was in the non-prime mortgage business. And in 2007, when everything kind of hit the fan, there were a bunch of us out there looking for our next move.
Right.
That's actually how I met Josh and Jake and a few of our partners that you know today. We were all in that industry and kind of stumbled across Medicare.
Right. Yeah, I know Josh has talked about, financial services industry, insurance falls into that. And he kind of had this shocked moment of like, I need something more stable, essentially.
Right. Yep. It really is recession proof. People are always going to turn 65 and need help with their health insurance. So regardless of what's going on in the economy or around us, Medicare sales is one of those things that just stays stable.
Right. So you started out with United, and that was a captive environment or independent? How did that work?
Yeah. So I was an independent. I was what they call an ICA, which is contracted directly to United Healthcare, but still considered independent. Now,
Right.
Independent in that sense is a little bit limited because while I was able to do other things on the side, I was not able to sell other Medicare plans.
So when in that scenario, was it still full commission, or was it like a base plus commission? How did that part of it look?
No, as an ICA, it was still full commission. It was
Okay.
full street level commission. I owned my book of business, but I could only sell United Healthcare. So
Gotcha.
when I was meeting with people, it was this United Healthcare plan or this United Healthcare plan.
Right.
Now, after doing that for a few years, I changed roles into an employed sales rep for United Healthcare. Once I made that move, I did have a salary and a bonus commission structure. Wrote a lot of business in that role, but unfortunately, when I left, I had to leave that book of business behind.
Right. And I know you've written an article about that because of your experience for agents out there. We've talked with Ethan before about, captive versus independent. There's benefits to both, but certainly that right there is the biggest drawback, of course, for anybody.
That's right, because a huge part of this business is mailbox money, residual income, and we work hard every day to help people and help ourselves as well at the same time. And you want to be able to constantly grow that source of residual income. And when you're putting in all those years of work, and then ultimately when you decide to make a move, it's unfortunate to have to leave that money behind.
Right. Okay, so let's get into the topic. Let's start from the very beginning. This is somebody that's already got their insurance license. We're going to assume they're looking at like, okay, what am I going to do? They find out about the potential in Medicare sales, and you just met them. Where do we start?
So you already have your life and health license.
Right.
That's important. Some people sell insurance. Maybe they just have P&C,
Right.
or maybe they have life only. Need to make sure you have the right license, so life and health. With that license, you can sell Medicare supplement plans without anything different other than getting appointed with Medicare supplement carriers.
Right.
If you want to get into Medicare Advantage and Part D, however, there are certifications and some extra steps involved.
Okay. So I'm coming to you and I'm saying, hey, I got my life and health license. I had a friend that told me about how much he's making with Medicare. All right, walk me through what my next steps are.
Okay, so you need to figure out where you're going to get your contracts. So there's lots of carriers out there. You can reach out to the carriers directly, but you might find yourself in one of those positions that I mentioned earlier where you are captive with that carrier. Some carriers don't allow you to contract directly with them. You have to go through an FMO or an upline like
Right.
the brokerage. So really the first step is finding a good upline FMO partner that you want to work with. And then from there, they're going to be able to help you with what carriers you should contract with and what the steps are. You shouldn't be forced to figure this all out yourself. That's what a company like the brokerage is for.
So segue, let's go into both paths. Let's start with what you started with, which is more the captive route. Obviously, those companies provide a lot of that training, a lot of the resources. But let's say I've decided, you know what, I'm going to go the captive route. Let's walk down that path of what my next steps would be.
Okay, so you're going to contract directly with the carrier in that case. All of the carriers have what's called broker managers or agent managers that it's their job to work with agents, both new and experienced. So they're going to really be able to help you through the contracting process. They'll help you get trained up, maybe put in front of some opportunities. But keep in mind that these broker managers also work both sides of the fence. So let's just use United Healthcare, for example. They have two channels. They have their captive independent agents, and then they have their external distribution channel agents. Some of the agent managers will work with agents in both channels, but in most markets, they have them separated. So if you're going to go direct to the carrier, you'll probably have an agent manager who manages direct agents.
Gotcha. Okay. And so I've got my license. Next steps as far as like certifications and such. I know you mentioned that. Like, what does that look like?
So most carriers require something called AHIP, which is a universally accepted certification exam or course, so to speak. It can be kind of intense. It teaches you a lot. So let's take a step back. When you get your health and life license, there's very little information about Medicare.
Right.
Very few
So a bunch
questions.
of annuity information, pretty much.
Right. Whole lot of information, and if you don't get deep into life sales or long-term care, disability, really not a whole lot of applicable information in the insurance license itself.
Mm-hmm.
So then when you decide to get into Medicare and you take AHIP, it's a whole different world that you didn't know about to this point. But it's really important because it gives you the background on what is Medicare, what are the different types of plans available, compliance. There's rules that we have to follow. So you do that, and you have to do that every year. But it's actually a good thing because it separates you from everybody else out there who has their insurance license. Just because you have your insurance license doesn't mean you are allowed to even discuss Medicare Advantage or Part D prescription drug plans with prospects. So it really separates you. Some agents are kind of scared away from the business due to that. They think, oh, there's so many rules, there's so many compliance. I don't want to get in trouble. I don't want to jeopardize my license.
Mm-hmm.
But it's really not that bad. We're supposed to be following the rules anyway, so you need to know the rules.
Right. So now let's move to the independent agent side of things. Same thing. You're going to have to do certifications. AHIP, if you're with United Healthcare, technically they don't have to. They've got their own path. But the big ones, Humana, Aetna, they require that. So how do I decide as a broker, if I'm just starting out and I'm on the independent side, what carriers I need to be selling? Because it seems like there's a new one available every month. And, obviously us being on the FMO side, we want to push those partnerships, but also like, how much do you really need? What would your advice be on choosing your portfolio?
Okay, so I can answer that a couple of different ways. So let's say that maybe you started off as a captive agent with one carrier. Sort of the natural progression is going to be you're starting to see other competitor plans out there that you can't sell. So as you're meeting with somebody, maybe they have doctors that aren't in the one plan that you can sell's network. So you're trying to figure out every day how to sell against these other plans. At some point you say, you know what, I'm tired of leaving business on the table. I want to be able to offer more. So If you want to be able to move over to the other side, you can do that. You just ask for a release. You come to a company like the brokerage, and then you can add those other carriers. So sometimes you figure out which carriers you want to add based on what you see in the market. If you've already been selling, you'll know when you're pre-qualifying people what plan you currently have. If you start getting a lot of the same response, I have Humana, I have Aetna, and then you can do plan comparisons and figure out either how to sell against it if you can only sell one plan, or how to convince them to change, or you can be on the external, like the brokerage side of the fence, where you can offer all of them. So you're truly putting people in the right situation. Now, the other part to that question is, how do I decide which carriers or how many? If you're brand new, you don't know. So that's where the people that you work with your FMO should be able to help you with that. Now, the big ones, United Healthcare, Humana, Aetna, and then there's lots of other plans that I don't want to leave out, but those are really the big mammoth ones in most markets. I recommend starting with 1, 2, or maybe those 3 big carriers. There's nothing wrong with starting out with one. I like to explain it like when you're sitting in front of a prospect and you're asking them questions, you don't want to just put every plan available in front of them, because they will never decide.
Right.
You're just going to make their heads explode. They're not going to be able to decide. So when you're a new agent, it's similar. If you're trying to learn too many carriers and too many plans at once, it can be information overload, and you never really become an expert at any of them. So a lot of agents like to start off with 1 or 2 of the big carriers and really learn those products, and then add as needed.
Right, right. And also something we didn't mention is that there are production requirements with your contracts a lot of times. So if you, let's say you're like, being the one that runs our website here, I know a lot of people, they'll just click every single carrier when they want to get contracted. It's like, do you really want that? Because like you're going to have to sell some of all of that to keep the contract.
Yeah, that's true. And not only that, the AHIP doesn't automatically take care of all of the certifications. So you still have to do some carrier-specific certifications, and you have to do those every year. So if you're contracted with 15 different plans, AHIP is going to take care of the majority of the certifications, but you're still going to have to log in to each and every one of those carriers, take their own certifications. If you're actually selling them, you're going to have to keep up with that book. So you're going to have lots of different, that's where you start getting into, you want to make sure you have a CRM. You want to make sure you have pretty tight systems in place to make sure you're getting paid what you should be getting paid. Mm-hmm. It can just turn into more administrative duties. Keep it simple. Don't try to contract or sell too many plans. Just like with anything, you're going to be perfectly fine if you offer the main popular plans in your area.
Right. Okay, so I feel like so far we've covered, I've got my license, there's the captive channel, I got the one carrier, they kind of provide everything I need, and I just sell their stuff. I have the independent channel. Either way, I need to take the AHIP, my certifications. And if I'm just starting out, I guess something we could recommend is that they go to our Simply quote engine and type in their zip code. And then they'll see some plans aren't even available where you're at. That's another thing to consider. You might contract with like Karen Care, I think, which is more of a Dallas-Fort Worth carrier, and you're in like Tulsa, Oklahoma. You can see that that's an option on the brokerage website, and then find out that's not even in your area.
Right.
So,
yeah, obviously it doesn't make sense to contract with a plan that isn't even in your state.
Right.
There are a lot of regional plans that might just be local to one particular city or part of the state, like Community Care, for example, in Tulsa area of Oklahoma. It's a really popular regional plan that once they did give the ability for agents to offer and sell their products, everybody wanted to come out and do that. And so that's where it makes sense to add that, because it's a popular plan in the market. Brokers couldn't sell it before. Now they can. It makes perfect sense to add that because if you are already an agent in that area, you were having to walk away from business because community care was the plan for them and you weren't able to sell it.
Right. Okay, so I feel like we've got a good understanding of where we start. Now, okay, I've got my contracts, I've got my certifications done. Let's walk through the selling cycle of Medicare, because it is very unique when you compare it to property casualty or life insurance. Let's talk everybody through the annual enrollment period, the open enrollment period. Not that we have to do the Medicare basics, but really like in the life of a broker, what that looks like in terms of their sales cycle, and like give us a timeline of what their day-to-day needs to look like throughout the year.
Okay, so there's the Medicare business sales process is going to be pretty different from other types of insurance, especially. A lot of the products that we sell are zero premium plans. How much easier does it get than to sell somebody a zero premium product that they need and can benefit from? It doesn't get much better as a salesperson, as an agent. So there are other plans, though, that do cost them money. Supplement. Again, there's not a one plan fits all for everybody. So it's a matter of categorizing almost everything. One is the prospects. Are you going to focus on prospects who are not yet eligible for Medicare? Maybe they're turning 65, or maybe they're already beyond 65 and working and considering retirement. Those are going to be throughout the year. People are turning 65 every day. More than 10,000 of them in the U.S. turn 65 every day and become eligible for Medicare. More and more people are working past 65. So that's a really good source of prospecting, not only because you get to get in front of them and basically become their trusted agent from the get-go. Nobody's had a chance to spoil it for them, give them a bad experience. If you do a good job on the front end when they're brand new to Medicare, you're going to be their go-to guy. If they need to change plans from the one you put them on originally, you want them to call you and say, hey, something's changed with my situation, or I see that there's a new plan in the market. You want to remain that agent for that person. So those can happen all throughout the year. Now, annual enrollment period, which is October 15th through December 7th, that's when everybody on Medicare can change their plan. If they're happy with their plan, they don't have to do anything. They're automatically re-enrolled. So a lot of marketing that we do during AEP is targeted towards people who are already on Medicare. Based on the data, we assume that they already have a Medicare plan, and we try to put information in front of them that is something new in the market, new and exciting, maybe a unique benefit that wasn't available before. We want to try to get with them and see if it makes sense for them to change plans, enroll them in that plan, and we're the agent of record. You can look at the annual enrollment period almost as tax time for your CPA. You know, that January through April is their busy time. That's when they make the majority of their money.
Right.
Same goes for Medicare. During that AEP, that's go time. That's when you try to work as many hours every day, 7 days a week as you can, get in front of as many people as you possibly can, and have as many enrollments for a January 1st effective date as you can. Now, as far as how the commissions are paid, because as a new agent, I know that's something that you're probably thinking about. You're probably not just wanting to go into Medicare sales just so you can help seniors with their insurance. Of course, you want to be able to do that. You like the personal interaction. You like being able to make an impact on people's lives, but you also like being able to provide for your family. So you probably are thinking about how to budget. What kind of money can I expect to make? So there's a difference in commission between somebody who's new to Medicare and new to Medicare Advantage, for instance, or somebody who's changing plans. If somebody has a special election period to change their plan throughout the year, your commission is going to be lower because it's prorated. So when you're first getting into the business, prioritizing who you're going to prospect towards can really help you figure out your expected income and budget accordingly.
Okay. So let's talk about marketing strategies then. In this industry, as all industries are changing quite a bit, and we at the brokerage are obviously trying to adapt and move those changes. But also at the same time, and I always try to keep this in mind being the digital guy, the traditional method is obviously still working. Otherwise, we wouldn't be making money.
Mm-hmm.
It's like, yeah, things are changing, so we need to keep with it, but it's not like our current strategies don't work. So maybe talk about what those are, like our main core offerings that have like made the brokerage successful thus far.
Okay, so marketing is a huge piece of it. You can be a Medicare expert, an insurance expert. You could know everything about every product and plan available, but if you can't get in front of people, it's not going to do you any good. So the brokerage, that is mainly what we do. Not only the back office support, but it's getting you as an agent in front of more people, because that is our model. We support our agents. So how do we do that? Direct mail is still working. You might talk to others out there that say direct mail is dead. You have to get in front of them electronically. You have to get in front of them by other means. There are lots of means, lots of ways to get in front of them. Direct mail is not dead. It's just finding the right piece for the right person at the right time.
Right.
So that's a constant process. We're always tweaking pieces. Some people will respond to branded pieces, like with the United Healthcare logo on it. Some people might throw that piece away right away because they had a bad experience. So it's not about guessing what they're going to respond to. It's about putting multiple pieces in front of the same people and seeing which one they respond to. And then we can run metrics on the back end and see what our return rate is. Mm-hmm. And then of those responses, how many appointments are set from them. Basically, what's the quality of that lead? So that's direct mail. There's digital, which is more what you're involved in. There's Facebook, social media marketing. If you as an agent or an agency have a website and a brand that you're building, there's SEO. You try to drive traffic to your website. Mm-hmm. We offer an enrollment platform for our agents where...
New and improved one.
A new and improved one coming out August, that's right. Really excited about it. So there's an agent tool that they can use to put in the prospect's medications, mm-hmm. doctors, filter through the plans. Anyway, I digress. But you can have the consumer-facing side on your website that you can drive traffic to. They can shop, compare plans, enroll, and you're the agent of record.
Right.
And then there is more grassroots, which is really going to be the best. That's where you develop your relationships out in the community. Mm-hmm. It might be provider marketing, working with doctors' offices. Sometimes it's working directly with the doctors. More often than not, it's working with the front office staff. When I was an agent, I used to spend a few days a month just strictly going into doctors' offices. And I would go in with a clipboard and a name tag, and I'd walk in, not to sell them anything. I would go in and just say, hey, I was in the area. I see that you're in the United Healthcare Medicare Advantage provider directory. But I've noticed that there's usually mistakes, and maybe it shows providers that do accept it, but in reality they don't. I work with a lot of people around here. In fact, I just came from an appointment, and oftentimes they have to change their doctor because they want this plan. I like to be able to recommend doctors to them that I know accept the plan, like the plan, are accepting new patients. We'll be able to see them soon. Mm-hmm. So do you mind if I ask, are you actually in this plan's network? So I start there where I'm just asking them questions. Yes, we are. Okay, so are these 3 or 4 doctors still in the office? Yes, they are. Are they all accepting new patients? No, they aren't. So it's really I'm qualifying this doctor's office to see if it makes sense for me to pursue a relationship with. Do you like the plan? Do you do the billing out of the office here? Do you have any problems getting reimbursed by the plan? I can introduce you to somebody with the carrier that can help you with that. Mm-hmm. So I'm asking them questions, and I'm also giving them little nuggets of my value. Right. Hey, you have problems getting reimbursed? I have a direct in with the plan. Are any of the doctors looking to actively grow their panel? Is there a newer doctor in the office who's actively seeking new patients? Okay, so it would make sense for me. Do you think that doctor would mind if I drive new patients to them? Oh, no, that would be great. Okay, cool. So now it sounds like this could be a good fit. Hey, I do seminars, informational seminars, actually just a couple miles from here. Do you mind if I leave some flyers in the waiting room here, advertising that?
Mm-hmm.
Some of my other providers that I work with like to be able to just hand my business card to their patients who ask about Medicare plans. So those are those referral sources that can turn into solid gold.
Yeah.
You might walk into a doctor's office and they don't want any more patients. They're full. Thank you for your time,
Right.
and move on to the next one. There's going to be community centers. You just think about, where do your prospects hang out? Who might be an influencer among that group of people,
Yeah.
and try to get tied in with them.
Yeah, I even know there's agents around here that, they get into the financial advisor space, and somebody that's kind of in their 60s, getting closer to retirement, they start asking about, and that might be more the Medicare supplement prospect, but maybe not necessarily. If they're going to a financial advisor, they might be more of a Medicare supplement prospect. Sometimes they're still MA. But that advisor can be like, okay, so we need to figure out what you're going to be doing about your health insurance. Here's my guy, Harold. That's a big thing that he does. And that works really great. Something that, just to contribute to this conversation, from being here, it's been a whole year now, which is kind of crazy to think about, talking to agent after agent after agent. What I've found is that just like you need a diversified investment portfolio, you need a diversified marketing portfolio. Like if you just do one thing, that might be okay, but the agents that seem to be really successful, they got a little bit of the grassroots. They do a little bit of direct mail, a little bit of digital. They'll even participate in our retail programs every once in a while. You know what I mean?
Mm-hmm. Yeah, that's a good point. Not every marketing activity is going to be for every agent. When I was selling, I really liked doing sales meetings. I did 3 to 4 every week throughout the whole year. And then I would do maybe 10 a week during AEP. I did a ton of meetings, because if you're trying to get in front of as many people as possible, you're going to have to group people together. Otherwise, everybody is one by one. If you can get 20 people in a room, that's obviously, you just saved, what's the math on that? 2,000% of your time? I don't know.
Well, and when you say 20 people, I'm sure it varied every single time when you were doing that. But like, what was the value of that? Like, would you say you probably got a couple enrollments out of that 20?
Yeah, it varied. And everything is a learning process. You're constantly tweaking it. So I got to where, before I even started the meeting, I would say, I would ask, did anybody come here just to enroll in this plan? And I'd wait. Sometimes somebody would raise their hand because they knew that their spouse is on that plan and they just came to sign up. I'm giving them the opportunity to go ahead and enroll before I even start the meeting. If you're lucky enough to have somebody like that, I would bring them the enrollment kit, turn to the paper application page, because obviously I can't sit there and go through the electronic one. I'm about to start a meeting. But now everybody else in the room saw that somebody else was willing to just sign up for this plan already. You know how the buyer's mindset is, if other people want it, it must be good.
Right.
Usually, though, people wouldn't raise their hand there, but I'd say, okay, well, you're going to have an opportunity to enroll here. So I'm setting the stage that you're here to sign up. If this is a good plan, you can sign up here today before you leave. That's ideal, because you're not having to follow up. There's nothing wrong with following up. Sometimes people have to think about it. They're not ready. As the agent, you want to make sure your meeting doesn't go too long. If you said it's going to be an hour, keep your presentation to 40 minutes so you can answer questions and have time to take applications. At the end, say, all right, if there are no more questions and you're ready to enroll, go ahead and turn to page 47 in the enrollment kit. Start filling out the first page. I'll walk around, help you with the rest. So it's almost assuming the sale, assuming the close. Some people are going to sign up. Now, if you're not ready to sign up today, this card that you filled out earlier, let me know if you want to go ahead and schedule an appointment, if you just want me to follow up. And then follow up is key. You can't expect to, if somebody didn't sign up with you right there at that meeting, that doesn't mean they're not a good prospect. Sometimes they will call you when they're ready, but you really have to have a system in place to be able to follow up with those people. So that's getting multiple applications, not only in one setting, but then it's pipeline. Sometimes somebody might come to a meeting that's not even eligible yet. They might not be eligible for Medicare for 6 months, but that's somebody that you just put in your pipeline. And so that's what it's all about. It's sales today, sales tomorrow. Always planting the seeds that you love referrals. Most people that I work with were referred to me by people like you because you understood the value in working with a local agent like myself. Right. I love getting phone calls from my clients. I also wanted to expand on something you said earlier about diversifying your marketing portfolio and working with financial advisors. You also want to diversify your product portfolio. There's nothing wrong with Medicare supplements. Supplements are great. The best agents have a nice mix of all the different types of Medicare plans. Yeah. Again, it's about doing what's right for the client. Right. Oftentimes that's going to be a Medicare Advantage plan. Oftentimes it's going to be a supplement. It's about helping them figure out which is best because they all pay the same colored money at the end of the day.
Right. Yeah, and there's something to be said about those two markets because sometimes we think, yeah, that's two different consumers, and we think of that more economically, but also it's health related. Like, for example, my grandfather, when he turned 65, he's got some serious health problems. He's broken like every bone in his body. He's got fake organs. He's got all kinds of stuff wrong. So when he turned 65, thank God, somebody knew to tell him, get a meds up, bro, because you get that guaranteed issue. Whereas his wife, grandmother, Medicare Advantage made perfect sense. They're not super duper wealthy, but because of his health issues, that's the best fit. So it doesn't always, a lot of times we just think it's income based. It's not always the case. It really is like you're saying, what's the best fit? And if you have an MA contract using United, for example, you've already got the med sup. So you need to just learn the product so that you can be able to say, sometimes it's going to be that simple. It's going to be a couple. You're going to sit down with both of them. One spouse, the med sup makes more sense. One spouse, the MA makes more sense. And you can just make two sales right there.
That's exactly right. We call those twofers.
Yes.
Husband and wife, those are great when you walk in, especially if you're just expecting one and then their spouse sits down and you walk away with two applications. It's a great feeling. But yeah, you're also right about the plan suitability. Some of my wealthiest clients enrolled in a zero premium Medicare Advantage plan. They could absolutely afford a supplement, but sometimes people are rich because they're very careful where they spend their money.
Right.
What do they say? Warren Buffett still drives a 1990 pickup truck.
Lives in the same house he's lived in since the 80s.
Yeah, very modest. So a lot of people aren't just spending money frivolously. Sometimes people think that the more you spend, the better it must be. Other people understand that that's not always the case.
Mm-hmm. Yeah, that's definitely something to think about. So if you're an agent out there, definitely have both. And then through the brokerage, of course, we've got all kinds of supplemental products that you can throw in there. Like if somebody's on a Medicare Advantage and they're worried about the copayment on certain things, we've got hospital indemnity plans to help cover that. Might cost them $30, $40 a month, and for them it's worth it to not have to pay that big like ambulance copay, things like that.
Yeah, absolutely. Absolutely. PNC agents have it figured out. The more products you have with one client, it's just exponentially higher retention. Mm-hmm. So your PNC agent is going to try to get your auto insurance, your homeowner's insurance, and life insurance. Right. Once you get to that magic 3 number, you're their guy. It's just too much work for them to, and obviously they trust you. They got all of those products. Same goes on our side of the business. If you sell them a Medicare supplement plan, you're also going to sell them a Part D plan. Right. And then since supplements don't come with additional benefits like dental, vision, that sort of a thing, a dental plan makes perfect sense to get in there. You got your 3. Medicare Advantage, like you said, hospital indemnity, that makes sense. So does dental. Some Advantage plans include dental benefits. They're usually pretty limited. Mm-hmm. But if you don't give them the option to say yes or no, 9 times out of 10, they're not going to ask you. They might ask about dental because dental is on everybody's mind, but nobody's going to say, hey, do you offer hospital indemnity plans? They don't know what that is.
Yeah.
If you don't ask them or tell them about it, give them the opportunity to buy it, another agent might be coming in right behind you and saying, oh, you have an Advantage plan and you don't have a hospital indemnity plan?
Mm-hmm.
Let me tell you why that agent should have told you about this.
Right.
And while we're at it, why don't we review that Medicare Advantage plan that other agent put you in?
Yeah.
Because if he or she didn't tell you about this, then we need to make sure that they actually put you in the right plan.
And that could happen. Let's say you made a sale in November, and then there's that OEP, which agents aren't supposed to do that, but it happens. And maybe they're not doing it, in a malevolent way. They just literally, somebody asked them a question, and they're like, well, let's look at this. Mm-hmm. Wait, he didn't tell you about. So we've had a conversation with Rob Douglas with UNL. He was on the phone one time. And I was like, well, how does this look in the day-to-day life of an agent? He's like, well, it's really pretty simple. To do everything compliantly, you're supposed to just talk about the MA while you're doing the MA presentation. But once they've made the decision, they've enrolled, if you've done everything in a really smooth manner, you can literally just say, now that we got that all figured out for you, I do want to ask you a question, though. We addressed that there is this max out-of-pocket, and there is a copay in X situations. I do have a solution that could cover the majority of that. Are you interested in hearing about it? It's a simple yes or no. And if you just ask them, he's pretty much like, it's a 50-50 chance. Yes or no. Okay, no worries. Yes, well, here's what it looks like. It's only X amount a month. Are you interested? Well, that commission could be about the same as the MA commission was.
Right. Doubled
your profit, and you helped them with a concern. Not trying to ramble. It's just, we're kind of talking to the new Medicare agents out there, and that's a strategy that we're trying to push continually here at the broker. Is we have a lot of agents that just think Medicare, and truthfully, there's a lot of money being left on the table.
That's right. I was guilty of it myself. When I was an agent, a Medicare agent, I was less than an hour in and out of every appointment, get my Medicare, either supplement or Medicare Advantage application, move on to the next one. Now, in working with a lot of agents over the years and trying to understand why they don't offer a hospital indemnity, why they don't ask their clients while they're in front of them, hey, are you taken care of with this? Now, we are limited. You can't ask them, when was the last time you refinanced your mortgage? You can't ask them, non-health related. There's certain products that you can discuss in that one meeting,
right,
based on the scope of appointment.
Right.
But a lot of it is, even if they don't want to admit it, it's because if they're selling a Medicare Advantage plan at zero premium, they never had to ask them to get out their checkbook. It was easy. They know that they're getting the sale, they're going to get paid, and they don't want to mess it up. They feel like if they then try to push another product on them, that they might lose the Medicare sale altogether.
Right.
Which I can understand that, but it's really flawed thinking because you're never pushing anything. If you're pushing anything when you're in front of them, you're doing it wrong.
Yeah, that's non-compliant, to begin with.
Right. And this isn't educational. That's what's so great about Medicare sales. It's educational.
Mm-hmm.
I feel like we're educators, we're teachers. Medicare is confusing. This is what A does. This is what B does. This is what all of these other options mean. You don't need to know about all of them.
Yeah.
Let me help you figure out, let me help you teach you what all of these different plans are and help you figure out which one is best for you.
Right.
We're not saying, hey, this is the plan you want and this is why, and it's great. It's got all these bells and whistles. If you come out of the gate like that, you're coming across as pushy and it's not really going to work. But yeah, you almost owe it to your client to give them the opportunity to learn about products that might make their lives easier.
Right. And just have good people skills. Play it by ear. If you're having a conversation with somebody and you can tell they're antsy to get out, you probably shouldn't bring it up at that point. But maybe follow up a few months later or send them an email or send them a thank you letter or note. And in that, just mention, by the way, like there's so many ways you could approach it. You know, obviously at the point of sale of the Medicare plan would be the easiest way. But like to those people that are out there worried, well, I don't want to lose the sale. Well, what about 3 months later? What about 6 months later? You know, how many touch points do you have with your clients? Which, to kind of start wrapping up the podcast, that gets into the last thing I wanted to talk to you about specifically based on your experience, because you've gotten to see both sides, and that's super valuable, would be the aspect of, okay, I'm with you, David. I got my certifications done. I'm with the brokerage. I've got my carriers. Now I've got some marketing ideas. But how do I pitch myself as a Medicare agent? So if I'm working with a carrier, they're the brand. I'm just a licensed agent of theirs. But now I'm in the independent channel. And I know we've got agents that, you know, they pretty much just leverage the carrier's brands, which is totally effective if you want to go that route. There's agents that fit better and to go through an upline between us that has their own brand, and they just kind of work under that. You know, there's something to be said about if you're just an independent agent out there, you know, you might not want to invest right away in, oh, I need my own logo, I need my own website, I need, maybe speak to that because you talk to agents every single day, your thoughts on how to pitch yourself.
Sure. So if you're a true independent and you represent multiple carriers, you don't necessarily have a brand. Gillen Boyer, nobody knows who Gillen Boyer is, no offense.
That's none taken.
But they haven't seen a commercial
right.
of Gillen Boyer, so you don't have that brand loyalty.
Right.
So even as an independent, it makes sense to utilize that brand. They're trusted. Humana, Aetna, Blue Cross Blue Shield, Mutual of Omaha, United Healthcare. Talk about diversifying. Start building your own brand and utilizing the brand of the carriers. So I'll use an example of community meetings or sales meetings. We have quite a few agents that really embrace that marketing aspect, and they will have different boxes in their trunk with different color tablecloths. They'll have a United Healthcare box, and it has their United Healthcare business cards, the blue tablecloth, their name badge. They'll go in, they'll do a United Healthcare meeting, and then an hour later, they swap it out for the green Humana tablecloth, their Humana name badge. They're handing out their Humana independent agent business cards. Mm-hmm. So they're utilizing that brand, multiple brands at the same time.
Yeah.
Now, when you've been doing it for a while, let's say that you want to go the agency route. Maybe you've been doing this for a while. Mm-hmm. You've gotten really good at it, and you want to start building a team. Maybe you got so much business coming in, whatever the reason. You can do that with the brokerage as well. There's agency level contracts. So at that point is really when most people, you become an agency principal. That's generally when you start really working on your brand and going into the SEO and trying to get some brand awareness. But you're also spending time working with those agents as well. So if you're a new agent coming in here, you might see that there's small agencies and really large agencies. The brokerage, we would be considered a large agency, but a lot of those smaller agencies that you might be talking to, they might be agency partners of ours. They might be working with us. And whether you're direct to the brokerage or an agent under one of our downline agencies, you're always going to get the same level of support from the brokerage.
Right. For sure. And I just want to be very practical with agents out there, you know, getting started, because there's multiple things to consider there. But I would say, like, income. All of these marketing practices, they're going to cost you money. You've got to have capital to invest. So to your point on the agency level, you know, I've told agents, like, when somebody looks you up on Google, they need to be able to find you. But that can be just as simple as a domain that's davidireland.com or whatever, and a one-page website that's simply who you are, what you do, the carrier's provided, and a contact form. And people may not even ever utilize that website, but people do, especially as the boomer generation is aging in. You know, they're very much more tech savvy, and we talked about multiple touch points of marketing, you don't have to have this full-fledged website with all these options, but you do have, hey, you can at least look me up, or that's a place that when you're emailing people, it's your domain, and you can send them a link to your Sunfire Matrix, Simply Enroll page, but that could cost you $60 for the year to do all that. Call it good. Check it off your list of marketing strategies. Like, you don't have to overthink this, right? But yeah, you've got an agency and you've got 100 agents under you. You want to, and you're a very localized, and you're networking with providers. I have an agency, a partner of ours that came to me and was like, "Hey, dude, I gotta do this. Like, I built this big agency and I have no brand." It makes a ton of sense for that person. Like, they need to have a logo, all that stuff. But if you're just starting out, and like you said, my name, nobody knows who I am in that industry. Plus, I'm younger, so seniors probably aren't going to take me that seriously. But if I have the United Healthcare logo, the Humana logo, the Aetna logo, kind of makes you more legit.
Mm-hmm. Yeah, and to that point, sometimes the independent agent website can work against you. If you've ever looked up an agent and gone to their website, they have a really long domain name, and it's a cookie cutter website with broken links. And
that's a really good point.
And about me, and it's just very unprofessional looking. That could turn people off more than you not having a presence at all.
Yeah.
So if you're gonna do it right. You mentioned Simply Enroll. That gives agents a personalized URL, which is in effect a website for them, and it is legitimate. It is very clean looking.
Mm-hmm.
It allows consumers to put in their medications, to search plans available in their market. Your agent's phone number, your phone number as the agent is right there for them to be able to call you at any time if they have problems or questions. If they enroll through your website, you're the agent of record. So that in itself is really going to be enough for most people.
Yeah, and if you, just to throw this out there, something we've probably never mentioned, it's as simple as you could go to Google Domains, buy a $12 domain. Let's say you don't like the long URL that we provide you. You could very simply buy davidireland.com, Chris Houston, GillenBoyer.com, and redirect that URL to your Simply Enroll URL. That way it's easy for people to remember. Hey, just go to davidireland.com. You can shop my plans. But it's just our page, right? That's a $12 investment. And to your point, that looks legit. Like, if nothing else, they can look you up and boom, shop my plans.
Yep.
And you really had to do nothing. So I haven't even thought about that yet, but that's something maybe for our road shows that we're doing this year, we might bring that up. Like, hey, spend $12, buy a domain. Here's how you redirect it. Boom. If you want to have that as our website. So something to think about.
Let's say that you're either an existing agent out there selling life insurance, other plans, and you've been referring Medicare business away. Maybe you're a PNC agent and you're referring Medicare business away. At some point, if you get tired of that and you want to add the ability to keep those clients as your own clients, just reach out to us. We'll be able to point you in the right direction as far as what you need to do, what you should do, if you even need to do it. But we just try to make it as easy as possible for you.
Awesome. Well, David, thanks for your time today. Remember to check us out at thebrokeraginc.com. If you have questions or want to contact us, you can also check us out on Facebook or connect with us on LinkedIn. Appreciate your time today, everyone, and y'all have a good week.